To begin our moderated discussion, I'd like to start by asking you, Dr. Duran, when we think about policy solutions in addressing obesity, what are your thoughts on how we can advocate to improve government policies related to food access and food content in order to level the playing field for our indigenous populations and other communities of color?
Thank you for that question. I would say one of the most important components of that, when we're particularly looking at what does that mean in that context of being able to try to provide access for healthier foods and structures, is the inclusion of tribal researchers and data and information at the beginning of that. One of the things that we see is, when you look at the Dietary Guidelines of America or any of these other components, they don't often include a view of what would look like healthier meals or foods or traditional foods in the tribal in the tribal community context. So being able to have that type of information and components included and thought of in those programs and what those policies look like are incredibly important and sometimes may differ. An example of what this looks like is in the FDPR program that I mentioned before. The FDPR program, which is a commodity food purchasing program, has gone through an incredible amount of changes with the advocacy of tribal leadership and also the program managers who run that program for 276 tribes throughout the country. Starting several years ago, there's now been the inclusion of fresh fruit and vegetables in there, access to fresh and frozen meat, and also for the very first time, access to traditional foods. And as we've seen those inclusions in the program, now the FDPR program scores at a healthy eating index of 85, which is substantially higher than what the SNAP eating index is, a healthy eating index is. And part of that is a component of being able to for choice and what's available and what you can purchase with those benefits. But when we started to see that there's more control and say and tribal involvement in determining what's in the programs, what's accessible, what that means, what does healthy mean in that context, what does this look like, we see those changes start to make and we start to see those impacts start to happen. So I think in that context, being able to be there and involving in the process, having the tribally driven data and research inclusion that then informs and structures the policy, and then I think working towards that in its actual application.
Thank you. Dr. Bassett, I wanted to ask you a little bit. There are a number of individual medical interventions to address obesity, but in view of the modest impact of public health strategies, how do you advocate for public health policy approaches? And what avenues do you think we should be pursuing to those ends?
Thanks. I listened to the radio about a new medication that results in appetite suppression, and of course there are surgical interventions that should appropriately be made available to people with only an extreme case of obesity. But increasingly, people are thinking about how we can modify the person rather than modifying our food supply. And that, in my view, is a mistake. If we look at the trajectory of the prevalence of overweight and obesity and relatedly the prevalence of diabetes, it's related to changes in our food. And that's what we need help with. You can easily go into any number of fast food restaurants and eat what they market as breakfast and have consumed all the calories you should have had that day. Now, should a provider, a restaurant be able to call that breakfast when it's all the calories that you should eat in a day, and say that it's simply up to the purchaser to figure out how many calories they should eat or to educate themselves better? I really think we need much more robust action on the shifting nature of our food supply. And I mentioned ultra processed foods, and forgive me, I don't really work actively in this area, but I do feel strongly about it. There have been laboratory experiments that show that the same calorie content when it's in real food, food that you and I recognize and know how to make, versus when it's an ultra processed food, which is food that we can't make at home, really. Um, and the people are more likely to eat more of the ultra processed food and consume more calories and gain more weight. So we need to have more federal action, not just advice on the nature of our food supply. Um, that's my view, because it just isn't going to work to treat every single person with obesity. There are now too many of us.
Thank you. And I think that leads me into my next question, which is when we think about policies that have been more and policies that have been less successful, one thing that often comes up are these issues of food taxes or beverage taxes. And so thinking about the work that each of you have done, and whoever wants to take this first can, what do you think the utility of those types of taxes are, and possibly in relation to other policies that we might want to pursue?
Oh, I don't know who. I'll go first since I'm unmuted. So I support sugary beverage taxes. I don't know, how likely they are to take hold in the United States, but it's clear, just like cigarette taxes, that when you that these are products that will respond to price increases with a decline in consumption. And these are, if there's a single food that or if we want to call it a food, that we could demonize as, is correctly called liquid candy, it would be sugar sweetened beverages. And of course, the burden of this falls more heavily on low income people. And that's a conversation that's worth having. But of course, the marketing of these products have been, truly predatory in terms of its marketing to, low-income neighborhoods. At the health department, they found that the presence of advertisements for unhealthy products like sugar-sweetened beverages were 3, 4, 5-fold more commonly found in poor neighborhoods. So, acting like this is simple choice is not correct. So the data from Mexico, which did this nationally, shows a decline in consumption. The data from Berkeley, California is less conclusive, and of course in Chicago it was reversed.
I'm glad to talk a little bit about that. I think from the perspective that we have on it as well. But I think this goes a little bit to the introductory component of this, something that you had there about sort of the big P of policy, the small P of policy, and kind of looking at things holistically. Taxation issues and taxation authority are things that tribes as a whole are very sensitive to and look over. And tribes as sovereign governments actually retain their own taxation authority. So a tribal government can issue taxes, and sometimes often does, on particular activities that occur within its jurisdictional boundaries or reservation boundaries, or in any type of potential economic business they might be engaged in. And it's incredibly important when we're looking at economic activity on tribal lands, because tribes as governments, when they're providing services and paying for these services, there's no tax base for that, because tribal citizens are also citizens of the state and also citizens of the federal government. So if a tribal government is issuing taxes on that and the state is issuing taxes on that, that's essentially dual taxation. So those folks are going to be harmed. So when tribes are trying to generate governmental revenue, that's often done through a business and economic development lens and focus. So sometimes the imposition of an additional tax on top of that actually goes and hurts that economic activity and goes to actually taking away and some of their sovereign taxation authority rights overall. And what we see as the best example of what this looks like in practice is when a tribe as a government makes that governmental decision to issue a tax. And we know Navajo Nation has done that to be able to issue, I think, a junk food tax. So being able to have that and retain that authority so that they're the ones issuing that tax, that's a governmental decision that they made to be able to do that. And then they receive the revenue and then are able to determine how that's used for the benefit of their citizens are incredibly important considerations of it. So trying to do something in a larger scale, and it would even say at a national scale, would be something that would be seen as a way of almost giving away a tribal taxation and governmental inherent authority for that type of activity. And so even though there may be substantial benefits to that and being able to do that, from our perspective, we want to make sure that the tribal governments are the ones that are engaged in activity, making those governmental decisions, and then receiving the taxation funding benefits that they can use directly for the services for their citizens.
Is there any arrangement for access to the revenue that comes from excise tax by the nations?
There's some, and when it does happen, it's usually based upon heavily negotiated agreements, particularly around gas tax. And those are typically done in lieu of litigation because of how precarious the courts have treated there's a governmental balancing test between that. And so oftentimes it's less expensive to negotiate a lower cut of an excise tax or a fuel tax of the state. Washington State's probably the best example because you have so many tribes that are located along the I-5 highway that goes up along the coast. And so they have gas stations as well too. And so they are collecting, a portion of the tax and they're splitting it with the state. But those are all negotiated agreements. Those are things, and that is heavily dependent on the relationship you have with that state. So in Washington State, historically, there's a better relationship with the 29 tribes there and the state government. If you were trying to negotiate something in this, and I'm not going to call it a state in particular, we could probably have some in mind from the past couple of years about who's supportive of who's not of tribes exercising their authority. That there's just never going to be, I wouldn't say a seat at the table. There's not going to be a table to have that conversation.
Wow. Okay.
Thank you so much. I think this is sort of very indicative of that issue of making sure we have a lot of different voices and perspectives at the table in terms of intended and unintended consequences of policy decisions. We do have a question from the audience. Colby, they'd like to know your opinion about ending farm subsidies.
Just generally, I don't think we have a firm stance on ending farm subsidies. One of the things that we've been really focusing on, looking on, as it's been I think in the news a lot, is who's receiving not just farm subsidies, but who's receiving a majority of the benefit of USDA funding and programs. And I think what we've been able to see, particularly from USDA, even in its pandemic response, throughout the last year, some of the biggest payments that went to a majority white, male, large-scale farmers, which left out almost everybody. I think the number that was even USDA is using is upwards of 97% of like the $9.3 or $2 billion they got from the CARES Act went to those types of producers. So when we look at that, we look at equitable access to those programs. And so I think even with farm subsidies, we also need to look at what are those focused on and what are the activities that aren't getting the support. I think we're looking at some of those activities that a lot of tribal governments are engaged in, which could be livestock or bison, could be specialty crops, fresh fruit and vegetable, traditional crops, which don't have a place in some of the larger scale USDA programs. So I think it kind of goes to that sort of really rethinking and reshaping what USDA's programs and support structures look like overall, and really what is agriculture and what agriculture should be. And I think the last point with this as well too, while we're currently still in the pandemic, at the very beginning of it, with the food shortages that were occurring, one of the things that we saw is that our larger scale food system is broken. There's almost no place except probably in California where you could drop a pin and feed people in a 200-mile radius with everything that they would need to have a healthy, nutritious meal. So because of that, we need to actually not think about this food from a larger scale landscape, really, of how do we feed everybody with everything, or we're going to do this type of production here or that type of production there. We need to really kind of scale it back and invest in localized, strong food structures and hubs that can provide the food and support, not just to the people in there, but to the producers in the area, which will never be able to sell in a large scale food processing market because they would be priced out of it, or they would be hundreds upon hundreds of miles away. So when we're really rethinking and reshaping these programs, we need to look at their application on the ground, not in how the programs have been historically structured.
Thank you. I think you make a great point about, as we think about policies and trying to move towards innovative policies, not just repairing the policies we currently have, but really reimagining what we think policy is, what it can do and who it can serve. And shifting a little bit, Mary, I want to come back to you because there was a question about, what do you think the role or what role do social movements play in lifting up data and policy innovations, and thinking about how that might relate to obesity solutions?
Thanks for that question. I mean, I really do think that the social movements are what really create the context in which we advance the health and well-being of whole populations. And we're witnessing that now, right, with the increasing focus on equity, which is undoubtedly related to the murder of George Floyd and to the kind of not just national, but even global racial reckoning. The strategies that the New York City Health Department used in the Bloomberg and a bit into the subsequent administration, de Blasio administration, was really a top-down approach. And many questions were raised about the fairness of some of these strategies. And I think that the community-driven strategies have been more on the side of supply. We need to increase the availability of fruits and vegetables. And we need to try and address the issues of cost. We need to increase, supermarkets in neighborhoods that are food deserts, and the presence in urban areas, at least, of farmers markets in neighborhoods. And New York City did do some things on this. But I would say that that's more where the social movements have taken us, and urban agriculture, and in the promotion of more access to healthy food in your neighborhood.
Thank you. And we received a question from a student who's interested in pursuing public health, and they want to know what recommendations you each have for the next generation of change makers and decision makers around policy, either broadly or as it relates to obesity solutions.
But you should go first. I mean, well, I'm a government. I believe that the role of government is to defend the population. And we are, what we're talking about here is big food. Just like we talked about big tobacco, we talk about big pharma. We have a food system that is largely controlled now, not by small farmers, but by big industrial concerns that, and it's my view that the next generation should continue to advocate for regulation and provide the data that we need to make the case that a healthier food supply needs to have a more even playing field, and not one that has made ultra-processed food come to dominate our diets.
It's a great question, and it's exciting to hear folks that want to be able to continue to go in this field of study and be able to do that. I'm a lawyer by trade, so I'm probably not the best person to give you advice to hop into the research. But I think for how it's applied and how it can really create change is, I would say continue to really pursue your passion and the work that really drives you, and I would let that sort of be the driving force and what's really being able to put you into those positions. The scale of making change and having impacts on policy, I think, is greater now than it ever has been. When you're looking at being able to see the idea of being able to get a message out so quickly and get so many people behind it so fast. Some of that goes into the need to have a 24-hour, sometimes even less, 12-hour news cycle to have things thrown in there. So it's about having the accuracy of that information, the data that goes along with everything, but then that also puts into play what's the change, what's the ask, what needs to be that specific component, because all of that's going to be interconnected. So when you have those moments and opportunity, as you're going through your fields of study and going into that, looking at putting all of those things together, where you're almost simultaneously building that as a big part of it. And I would also say, and I think this is, what Stephanie really mentioned is, like, we're in a place where we don't need to think about what the current or existing or old structures look like if they don't work. So if it doesn't work, it doesn't mean it has to work in that context. It can be put in the framework and structure that makes the most sense based upon the research you've done and your experience with it and your work with the communities and folks that you're serving and trying to be able to help. And like, I think another really big part of that is to I would encourage you, anyone else that's a youth or a student going through this, to not be afraid to have your voice be heard in the process. When we were engaged in the 2018 Farm Bill, I would say, even though I include myself in the larger category of folks who are advocating, the best advocates we had were tribal youth who came and spoke with congressional lawmakers and talked about why this change needs to happen and how it will help them, their fellow youth, and also their families and communities. Those types of messages and the power of that youth voice is astronomical. So don't lose the power of your own voice, the power of your own story, and let that be the driving component that takes you to where you're going to go. And best of luck to you.
Thank you both for those answers. And I just, as a professor, want to agree with both of you in terms of helping our students to learn to use their voice to advocate for change. So thank you. Mary, we have a question from the audience. Shifting to policies instead of people is spot on. However, when local health departments are able to develop equitable policies in certain places, there's a challenge around state preemption. And so they were looking at the example of Philadelphia sugar sweetened beverages. And so what's your advice in those situations?
So this is for people who aren't familiar with it. It's when the state passes a law that says that our law takes precedence over you, the local jurisdiction. And this has, been a very worrying development, because it means that innovations in local jurisdictions, which may be go further than the state is willing to go, can be rolled back by preemption. And it just has to be fought in the courts. There's just no other way to do it, and in the legislature to try and overturn these laws. New York City was able to overcome some preemption claims, but not all. And this is this is a serious threat. It's a legal threat. We have a lawyer here. He'd like to opine on the idea of corporate free speech and preemption, which are the two tools that are being used.
Yeah, and I also want to jump in just to note that when we're talking about these decisions that are made at the local, state, and federal level, that ties back to something I mentioned at the very beginning about the importance of voting and voting rights, and how voter rights laws impact health in these very indirect ways that we often don't think about or see. And so making sure that we have people who are advocating and active, as well as voting in every election they're eligible to vote in. New York is having their primary today, for example, making sure that we're all engaged in that, so that the policies that you want to see happen at the local level aren't preempted by the state, because there's a consistency in priority across those different groups and agencies. I don't know if Colby wanted to weigh in on that, because you have a more complex, I think, structure in terms of preemption.
Yeah, I think it's interesting. Like, a preemption generally, a lot of times we we actually look at in some ways, and it depends on the topic, support the idea of the larger federal component because of the direct relationship between tribal governments and federal governments as being that direct relationship. So taxation authority, we'd want to have federal preemption over state components as well. But I think it speaks to, with that though, tribes of sovereign governments act like local state governments do. So they need to retain that power and authority to be able to do that. So you have to have their voice involved in that process and look at what those implications are going to be on this, because it goes a lot into that, and I'd not to go too much into the corporate voice in components of it, or get really political because we are being recorded. But when we talk about like a corporate voice, I think it goes to like talking about, how do we make sure that the voices of the people that are being impacted by these decisions and actions are the ones that are being heard, not a larger scale voice, which is not representative of this. Corporations are representative of their shareholders, if they have shareholders. They're not representative, particularly of like the consumers or customers that are purchasing their product. And so market share is not something that should be equaling a larger scale voice, because it's representative only of their corporate success and their board versus who's actually being served by that product and whose interest are you protecting. So the idea, I think, Mary, of the government's there to protect the public interest is an incredibly important thing to think about in this, is because, corporations are and work within the laws that are provided, and they have a responsibility to their shareholders, and one that they have to follow because that's what they're supposed to do. If they do not, those folks that are in power most likely going to be out, and they're going to find someone else that will do that. So they have to respond to that. It's the government's role to protect the people in that, and to help support that component of voice, and to maybe change the structures of the laws that corporations have within that to have to operate.
Thank you.
Thank you so much. Thank you to everyone in the audience for your thoughtful questions, and to both of our speakers for your presentations and to all of your answers.